So what can people do? I mean, is there, I mean, I know this is kind of off the cuff, but what can people do like in their communities to make this education more accessible to share this?
I actually love that you asked me this question, because I actually held a titnic. I created a titnic. It was a picnic for breastfeeding moms, and I did this in 2019. It was just something I felt like I needed to do for the community. I was trying to figure out, well, how can I give back? You know, this is before I launched What the Boob. It was previously prolacting, but we could get into that later. And through that public event, I connected with other LCs in my neighborhood and I asked them, I said, would you be able to donate some of your time to come to this event? I invited Black women to come to get education and to support each other, not just from the LCs, but each other. So hosting community events like that, well, that was pre-COVID, but now during COVID, even having a 30-minute webinar or even, doing like a Q&A session once in a while, or putting, infographics out there, something like that to entice women to come and be educated and just give it to them for free. It doesn't hurt. Everything is going to benefit the community at the end of the day. That's all it's about. So just having those free spaces and free events, that's one way you can definitely go about it. I'm not saying to do it all the time because people have to make a living, but at least, a little bit to give back to the community. That would
Yeah.
be a beautiful way. And I know the community would appreciate that.
Yeah, absolutely. And I think one thing with this COVID and everything, one thing that it's shown us is that a lot of stuff can be done online and with these webinars and events. And like, I think that's like something that, we've done at Mommy Knows Best is like online, in our Facebook group or, on Instagram, we'll just do live
Yes.
presentations and just talk about things
Yes.
because it's so many things that like first time moms don't know about.
Support groups. And that's also very important because women also find a lot of support from other women. So even just creating a support group as an LC, creating a support group and inviting moms to come in to support each other. And if you can, do a little check-in once in a while, have a little Q&A session, things like that.
Yeah, absolutely. I think that's so powerful, creating a community and a safe space for people to connect with each other. So I know we also really want to talk about like the history of trauma as it relates to breastfeeding in the Black community. So what can you kind of tell us about this? Where did this kind of start with, and then kind of where is it at right now? And
So, in order to really understand the correlation between the rates of breastfeeding in the Black community and trauma, I think you have to take a look at the history of breastfeeding for Black women in America in general. That's the only way we're going to see where it came from and how it's affecting us now. And, just looking back on it, just being a Black woman, coming in as a Black slave, right? Having to breastfeed your oppressor's child and put your own child aside can have a psychological effect on you, right? You can have, because of the trauma, because of all that you're encountering, being in that position can cause you to have a negative association with breastfeeding in general. I can only imagine for me as a being experiencing something as traumatic as slavery and then having to breastfeed a child that's not my own, neglecting I don't want to call it neglect, but being forced to, neglect the nutritional needs of your own child. And then it's hard to come back from that mentally, right? So what happens is that, for example, you have grandmommy who experienced this, right? Who is now creating her own formula because that's sometimes what they ended up having to do, using things like arrowroot and stuff like that to create formula for their own children. So then their kids know that that is the new norm. And then what happens? The next generation comes in and sees bottle feeding as the norm. So now it's continuing generation after generation after generation of just bottle feeding. No one knows about breastfeeding anymore, and conditioning is key. In order for you to have it normalized for you, you have to be exposed to it. I grew up, my mom, I have two younger sisters. So I grew up seeing my mom breastfeed, and that's all I knew. So as soon as I got pregnant, it was like breastfeeding was what I knew I was going to do for both of my kids. I didn't know anything else. So I think that that experience has changed the psyche of a woman, which has then manifested itself into the lack of education and knowledge and exposure to breastfeeding in their own communities. So what do we need to do? We need to allow women to be more exposed, which is why I'm so grateful for social media, because now you have a lot of Black breastfeeding pages that's showing women breastfeeding is normal. It's normal to breastfeed at 1 day old, 6 months old, 9 months old, 12 months old, 24 months old, 2 years old, 3 years old. So we need to continue that exposure. We need to continue to normalize breastfeeding in the Black community. And even through media in itself, I know, they're working very hard to implement breastfeeding into shows. You would often see it in shows now, moms breastfeeding their babies publicly. Um, but even through the graphics and the images that we're putting out there when we're advertising breastfeeding and breastfeeding products, right? Make the images more diverse, more Black women. That's how we're going to allow Black women to understand that, yeah, this is not for us. We are also included. So, just to bring it back around, I create animated videos that educate women on breastfeeding, and I'm very specific about the graphics that I use. I use I use Black women, Black babies, Black families, so that it becomes normalized and ingrained in their head, because the subconscious is very powerful.
Yes, absolutely. I think that representation is so powerful because you want to see someone that looks like you doing it and knowing that, oh, that's normal. That's
It
something
is,
I can do too. Um,
yes,
and that impact is so powerful. So what kind of
yeah.
other resources, so obviously representation and you talk about these, education courses, what other kind of resources, like when you have people of color and Black women come to you,
Mhm.
what kind of resources do you provide them with? Like if they're maybe if they're currently pregnant and they
Mm.
are looking into it, but are still kind of worried about this new avenue, what kind of resources do you provide?
Well, usually when these moms come to me, I usually try to be the one to educate and support them as much as I can. So, I always tell them, okay, well, what questions do you have? Let me answer some of it for you. Let me dispel those myths. And then what I also encourage moms to do is to reach out, like if they are delivering at a hospital or a birth center, sometimes these places offer courses. Well, not really a course, but one class that they can take. It's usually nothing that's very long, but a 1 day class that they can take. So I usually tell them to, reach out to their provider and see if they're offering any breastfeeding courses. Then La Leche League is also a great place to find any information. If they also want to find information about breastfeeding and how it translates to being beneficial for babies, then the American Academy of Pediatrics. So I usually keep it there, but a lot of the times they like to be very personal. They want to have someone to talk to. You can always read things on the internet, but they want to have that one-to-one relationship. So I try to be that person to do that for them.
Awesome. Yeah, it's like back to that connection that you kind of talked about earlier.
Connection is key.